So how were you impacted? Did you see anything that you saw was kind of fake out there? Or?
Yeah, I guess a couple times. I think some politicians definitely led to misinformation in the early pandemic, which definitely affected a lot of people. Not as much me, just because like I don't support that politician, but I know it impacted a lot of people. As well as just on Instagram, a lot of stuff is like being spread there that's untrue, and so that definitely had an impact on me.
Okay. Oh yeah, we're also supposed to mention the Mentimeter code. The Mentimeter code here is 3901-1925 if you want to connect to that link, and leave your comments there. What sort of things were you seeing on Instagram?
There was always different stuff. Most of it was good articles, like lots of them. I follow the SD61 account, which is always posting about what schools are getting like shut down or have COVID cases. So that was definitely interesting to follow along with. As well as, I'm not too sure, there's honestly lots of misinformation everywhere. Definitely when looking up cases, the answers at the beginning, they're always like scattered and you never really knew how many cases there were around you. So I definitely had a lot of like misinformation with that at the beginning, yeah.
Okay.
Yeah.
Did you follow any of Dr. Bonnie Henry's stuff or the public health information that was coming out?
I definitely watched a lot of the Bonnie Henry's like interviews at the beginning, and then slowly along the way, not as much, but definitely her reports were like all over social media, and I saw them a lot.
You mentioned in your presentation that you went on Worldometer a lot. And just kind of get the COVID updates. Is there any other websites you kind of went to?
I think that was my main one, just because it was really easy to follow for like the general, like if I didn't want specific about where I lived, it was easiest to just see it there. But if I was looking for more like close to home, definitely just going to the news and checking that out, which is usually pretty solid information. So yeah.
Juan, I know you work in this area. Have you been seeing youth impacted by information and disinformation?
Hey, Chris. Can you hear me okay?
I can hear you fine.
Good. No, I think this is a, I mean, I think as public health practitioners, this is an area that we need to really learn to master and start being able to reach to populations through other mediums. I think we're still rely fairly heavily on traditional media approaches, and that was interesting in hearing, just actually asking Theo, like if there is not just the specific, I guess, channels, but what about the content format? Like, does it make a difference if you're getting information in the form of a video versus writing versus, I don't know, I guess voice? Is that something that you have seen a difference in how people are absorbing the information?
Yeah, definitely. I think a lot of people my age are not really big fans of watching the news or really listening to any like long videos longer than like 30 seconds. I definitely have a hard time watching anything longer than 30 seconds, to be honest. So I think definitely the way people were get information is more from just like very simple, like simple worded, like information. So like not as much like news articles or anything like that. It's more just like, oh, there's this post on Instagram saying we have 2 new cases that kind of stuff. That information definitely stuck with me more than like if I watched like a 10-minute video on it. I don't know if I'd really remember it as much. So I was definitely getting my information from simple worded posts the most, and the news was usually on in the background, but I never truly paid attention to it really. It wasn't really where my focus was. Yeah.
What do you think of the role of influencers in particularly in social media, and do you see an opportunity for us in public health to work more collaboratively with influencers to get the word out?
Yeah, I think definitely. I honestly, I probably wouldn't go and like follow a page just about public health. I mean, maybe now that I've done this, I would, but I think a lot of people my age, that's just not their thing. But I think influencers really have the power to spread a really positive message. And I think their the amount of people they have should really be used for the good. And I know lots of influencers are starting to do that, especially with the recent election in America. A lot of them were trying to get people out and voting, and I think a similar thing could be done with that with COVID. And I think lots of them are saying, please go get your vaccine. Like, I've gotten mine. It would be great if you could go get yours. Like, yeah, I think there's definitely potential there. Yeah.
Thank you.
Does anybody else have any questions or in terms of youth and how they're taking in information? Okay. So I guess you know, so you mentioned, was it Trump that really you were kind of watching? Because
I tried not to pay as much attention to that, but that was definitely where a lot of misinformation was being spread to young people, just because he's kind of like not has a very wide spread of where his messages go. So definitely like seeing that, you're like, oh, that's really strange. Like, I think there are some people who really do listen to those kind of people. So when they're getting misinformation, that's being spread to people, and that's never a good thing. So yeah.
I mean, one thing to consider, and I don't know how much are we doing this in public health. I know that through PHIVC we engage in a little bit in the curriculum design for schools, and I'm just thinking about the role that kind of media studies or just having a critical lens to how to I guess information that you receive in the news or different mediums, and there's probably an important role for public health to play in collaboration with the education sector.
Definitely
helping understand that. And I mean, we have our Kids Boost Immunity through PHABC, where we are partnering with teachers to learn more about vaccination and the role that vaccines play. But I think this is bigger than that, and I think that might be an area for public health practitioners to consider with respect to this the younger children population.
Yeah, definitely, that would be a really great thing, because I think that kind of stuff would be really great to get more like structured into the education system, and like learning about vaccines and immunizations, and just like talking, having the support of your class to talk about the pandemic with would be like really good, I think, and having group discussions about it in your class, like maybe in socials classes, history classes, even sometimes English classes, or like if you have like I don't know, there are lots of different areas to talk about it. We have like a leadership program at my school, so even just like talking about it in those kinds of programs would be really great. Just like getting an open conversation with everybody, I think would be a good thing to put into some education programs. Yeah.
Did they cover a lot of with COVID
I think they tried, but at that point, a lot of kids weren't participating anymore. So I think it was very difficult for teachers to get kids to participate. So it was hard to get an open discussion with kids about the pandemic. I know we had one meeting with our teachers where they tried to be like, hey guys, tell us like if you need any support, we're here. You can always come talk to us, and nobody ever went. Which I think is a bit of a shame, but I know it can be hard over Zoom talking with adults, and it can be awkward at times. So I can see why not a lot of people went. But I know at least my teachers tried really hard to make the kids feel as like safe and welcome as possible to talk about everything that was going on. But definitely it was kind of a missed opportunity. It just like wasn't executed properly. And I think if they had done it in a different way, it could have been really good. But unfortunately, it just like wasn't executed very well. Yeah.
The other area that we have seen, I guess, looking at the first question on how are children and youth impacted, I'm thinking about, I guess, adult minors and like older youth, and choosing to get a vaccine when perhaps they live in a family that doesn't support that. And I don't know if that's something that you have seen in your peers, but it's certainly been something that we have been seeing in some of our vaccine clinics where there's youth that will be coming on their own, and that has created a lot of, I mean, we have protests outside our building for parents that were very upset about that possibility, and definitely presenting or characterizing the issue as the health officials trying to vaccinate their children against the family will and separating parents from youth. But I think that misinformation or disinformation at the family level can also impact the level of access that youth have to certain healthcare options, including vaccines.
Yeah, definitely. At least with the people I know, I don't think a lot of them have like not had support from their parents. I know most people have gone to get it with their parents. So I don't have too much knowledge about that exact situation, but I know a lot of people who their families are not super keen on vaccines and like aren't confident in them, and they've just grown up with that, so now they don't want to get the COVID vaccine. But I think a few of them with convincing would potentially get it. But I think parents' opinions have a lot of influence on their kids. So for a lot of kids, it's like, oh, my parents don't want me to do this, so I just won't. So I think there are a lot of kids who maybe want to, but they don't really know if they want to go against their parents, because that can backfire in their home life. Even though it is like a legal thing, like they can legally do it, it's still like can leave problems in their home life. So, yeah, I guess I have had a bit of experience with it, but yeah.
Chris, we cannot hear you very well, Chris. I don't know if you're a little bit far from the microphone.
Sorry, I think we should go to question number 2. What are some public health strategies to support youth in accessing accurate health information? So what strategies have you guys been doing in your regions? Yeah, sure. What would you like to see, Theo?
I think it would be really great to have some really good places where you can learn about things in your classroom or from teachers, or even in like leaving little information pamphlets or places to get stuff in counselor offices, and having counselors that are like I know my school has a lot, but definitely having counselors that are always ready to be there and just that have the information that they need to like support kids, like say they're wanting to get vaccinated without their parents' consent, but they're a little bit nervous to do it because of what their parents will say. I think it would be a really good thing to have counselors with all the information that they need, like this is legal, you can do this. And just having that extra support, even getting some like extra counselors, like 1 or 2 days in school, I think would be really helpful because I know a lot of kids need that right now. And just having those counselors there with the correct information on COVID topics that kids might need to know about is one thing that I think would be really helpful in the education system.
Okay, and as we move on to distance learning, because a lot of education is now becoming virtual, do you think we should maybe book some counselors in for online sessions with kids during distance learning?
Yeah, I think that's a really great resource to have. And there, for a lot of people in their cities, there's lots of really great counseling places that do it online still. So like where I live in Victoria, we have the Foundry. And I know the people there would be so happy to be giving kids information and the support that they need. So I think it's really important that you just like know where to go to find that support and information, and really just getting counselors and professionals in the schools and other places would be really helpful. Yeah.
Right. I see Erin Champion has raised her hand. Do you have a comment, Erin?
Yeah, hi everyone. I'm the Northwest animator and also a teacher. I have been thinking about how much the distance learning has made teachers and students more equipped at using platforms like Zoom or online lesson planning tools to teach. One thing I do often see from people outside of the school system is creating resources for teachers, which is great. But often teachers have a million things on their plate, and handing them a resource is just one more thing for them to put into their year. And so having specific people that offer to be present over Zoom or be present in the classroom to do some of that facilitation and some of that teaching takes the pressure off of teachers to be an expert on yet another thing, and be able to give them some tools that they can then use to follow up with their class in the way that they need to.
Yeah, that would be great. I think that's like a really, really amazing idea. Yeah. I remember when I was in, I think it was grade 8, so the last year, we had some people come in and talk to us about mental health, and it was just like a day where we had people come in and just like discuss mental health, and like anybody could join in and share their experiences. So I think what you're talking about is kind of similar to that, and just having a person from the outside community like come in and try to teach kids about the importance of getting vaccinated, and also about like misinformation and how they should be getting good information, and the importance of being safe on social media and not believing everything you see. So that'd be really cool to have people like that come to classrooms. And I know if I was in a classroom, I'd really enjoy that. So yeah.
Yeah, and just having someone, kids being able to see this is somebody's job. There's career options out there to do these things and engage with other trusted adults.
Yeah.
Erin, can I just ask a follow-up question? I think it's a great idea what you're proposing. What is the best way for public health practitioners to reach out to teachers to explore those options? Is it like the one-to-one relationships that we can forge over times, or do we go through school districts and make it more of a program that way? What would you think is more effective?
Yeah, it's a really good question. I think that's something that Farm to School BC is constantly trying to get better at as well. Having the animator roles is super helpful, and having a community facilitator, someone trusted within the district, but also on the outside to find those ways in, and who would want that kind of information. I think on a bigger level, though, we need to start talking to districts, not just individual teachers and individual schools, and be promoting programs at the district level and even at the ministry level, to the Ministry of Education.
Mhm.
Just a housekeeping issue, Juan, while we still have time. Did you want to do the reporting for this session?
Sure. I wish I had been taking notes, but Theo can help me if I stumble.
Sure. If you want to take that on, that'd be great. Okay. All righty. Does anybody else have any thoughts about public health strategies that could maybe be used in schools or online to help access accurate health information?
Yeah, I think that's.
Yeah, well, I'm just trying to think of other things that we can, other ways to access. I mean, it's really online. How else do people access information?
There's libraries.
There's libraries.
But I think not as many people are going to libraries anymore. So it's not quite the most efficient way to get information out. But I know definitely there are still a lot of people that read and go to libraries all the time. So school libraries definitely should have the information you're looking for if you go look at them, because I know school librarians are they're very well put together, and they always have the most current information up in their library. And usually on your school's website, you have your library section, and usually if they have a current event that's going on, then typically there's lots of sections about them. So I bet if I went on right now, there'd be a COVID-19 section just to look at. There'd probably be a Black Lives Matter movement section, and then I'm pretty sure there's one about Indigenous rights and Indigenous things that are going on is it Northern BC right now? Yeah, and I'm also pretty sure they have some Fairy Creek information there too. So typically school websites have all that information for you there. Yeah.
Okay. Where you go, is that where you access a lot of your information? Or?
I would say not really, but it's definitely there for kids who need it. I definitely more just if I'm looking for information, I'll usually just look it up. Okay. And try to find a good source. But for some people, that's not always the case, and they don't know where to find their information. So the online part of your library is a really good place to find that, I think. Yeah.
Like overall?
That's a good question.
I know you're not on
Facebook.
No. Okay. Is there a reason why you're not on Facebook?
I don't know how to use it.
You don't know how to use it? Okay.
It's very confusing, and I can't seem to figure it out.
There's a question in the chat, Chris, from Kathy, and I think it's a good one. Just about how is the best way for students to learn, whether kind of individual session, smaller group, the whole class, a combination. Theo, this is a question for you, Theo. Like, yeah, what is your learning preference, I guess, to some extent, or what do you think your peers are looking for?
I think it depends on like every person, but for me, I really enjoy class discussions, and usually they like leave me thinking for a long time after the class. So I'm definitely a big fan of class discussions and debates and stuff like that. But there are some students who are more quiet, so sometimes like having small groups can also be really good, like having one-on-one discussions with a partner, I think is also a really good thing, especially for the people who are more introverted. So I think maybe splitting it up into a a whole group discussion and then sometimes having individual discussions is probably the best way. Personally, that's what I think is the best, but some people really enjoy like just like writing out their emotions and how they feel. So even giving a little project on like how I was affected by COVID-19 could even be a good thing just for kids to be able to write out their emotions and for somebody to hear it. So yeah, thank you for that question.
Earlier on, you mentioned how much you
Oh, sorry, we missed the part of that, last part of that one.
Yeah, sorry, the internet is a bit choppy. I'm gonna plug it into the Ethernet. But earlier on, Theo mentioned that you hear me okay? Can you now?
Yeah.
You're good.
Yeah.
Yeah, you were mentioning earlier how you enjoyed having someone come and talk about I think it was about mental health in this case. But I was just wondering about the role of listening to stories or personal experiences versus learning more, I guess, a little bit more of a scientific summary, a statistic. Like, what do you think is the most effective way of communicating for your peers?
I think I think it needs to have a good balance of both, because I know if somebody comes in and only talks about their personal experience, that some kids can't relate to that experience. So having the scientific part would really connect with them more. But then for other people, like, this is personally what I think like having people's personal stories being shared, like I can really connect with that, and I really would make me feel a lot better about my situation during the pandemic. But I think it just needs a good balance to have your information and a lot about the topic, but you also can be able to share your personal side to things and really connect with the students in the classroom. And so I think you just have to have a good balance of both. I don't really think, because if you do one, then some students won't connect. And if you do the other, then some students, you just got to have the balance. Yeah.
Yeah.
How much more time do we have? Alrighty. Okay, great.
Awesome.
Okay. Is there anything else we should talk about?
Yeah. Nope. Does anybody else have any comments before we go?
I think that might be everything.
All right.
Happy Miller, can you hear me? I'm in a bit of a spotty area for Wi-Fi, which is why I put my question, Theo, for you in the chat. That's really helpful. I'm writing my notes here.
Okay.
Yeah. So the to get experts, do you think that would work if you saw that online in a classroom? Like if a health expert was giving information to a whole class?
I think
as opposed to being in person, right? There's a little difference in that. I just wondered what you thought.
I think with the having it online, is a little bit of like disconnection with the person. And I think it is best to have them come in and they're there and they're not just talking and you have to really connect with them. But I think over line, really, you still can have connections with people. So I think it definitely would still be helpful over line, but maybe not quite as powerful as it would be in person. But I think there's still benefits if you do it online. Yeah.
Cool, thank you. And the other thing, because it's always great to get student feedback and student input. If students did a survey to put in their thoughts and ideas in response to questions from a health expert. Do you think that would be something that they'd enjoy doing?
Yeah, I think definitely. I think it really depends on the student, because some students maybe aren't as comfortable with sharing their experiences. But I think for the ones that are really eager on it, it would be a really, really great experience for them and a really great thing for them to do. And yeah, I think that would be great. Okay. How much more time?
Probably just a couple of minutes.
Alrighty. So it looks like we're finishing up here slowly.
Yeah. Don't forget to put your comments in the Peter. And the code is 3901-1925.
Alright. I think we can answer a few more questions if anybody has any. But if not, we only have 2 more minutes. So yeah. Okay.
Oh, we have a question.
And Chris, I have a meeting at 1, but I send my notes as well, and I don't know if anybody else is able to also report back. If we're the first ones reporting back, then I can certainly do it. But if we're the last ones, I might not be able to be there.
Thank
Okay,
you.
Sounds good. Thank you. All right.
Should we head back to the main group now?
We have to wait for Christina. 1 minute remaining.
All right.
Yeah, we're going back to the main group in about 1 minute. I guess, Kathy, if you're there.
Yes, I am here. Sorry, I don't have my camera either, but I hope you can hear me.
Yeah, did you want to participate in the feedback session in the main session? Like,
Is that happening now?
it will in about once it comes up, because they'll go through all the sessions.
Yeah, I'd be happy to.
Okay, perfect.
Yeah, I'm writing the notes that I remember from what Theo said. It's
Okay.
really helpful.
Perfect.
Okay, thank you.
All right, it looks like we're heading back into the main session now. Thank you, everybody, for coming out. We've really enjoyed our conversation here today.
All right, thank you guys.